All right, my name is Jeffrey Finney, and this is my practicum presentation, and I am a part of the Jinping Su College of Public Health at Georgia Southern University, Armstrong campus. My practicum was at the Georgia Department of Public Health, Coastal Health District 9-1, and before I started talking about my practicum, I want to talk a little about why I got into public health and the reason I chose to get a master's in public health. I graduated with a cell and molecular biology from Armstrong State University, the previous school that merged with Georgia Southern. After graduating with my cell and molecular biology, my bachelor's degree, I decided to get a master's in public health basically because before I graduated, I felt kind of feared or nervous about starting dental school, that I wasn't ready. So after reading a couple of blogs and getting a couple of words of advice from other people and other colleagues, they pointed me in the direction of getting a graduate degree before getting my master's in public health, or a master's in general. After thinking about it, I decided to actually go forth with it. I felt that it would be a great experience to build my leadership experience and also to help me grow as a person and help me be able to master dental school. So after doing my research, I figured public health would be a great fit for me because I've always wanted to know the overall health of the public in general and wanted to get a broader aspect on that. And I felt that public health would be better for me in doing that. Especially since once I go to dental school, I really want to help underprivileged people who can't afford dental care when it comes to oral health. So starting with my practicum, this is my final semester in graduate school, I did my practicum at the Georgia Department of Public Health, Coastal Health District 9-1. The Coastal Health District's mission is for its counties, in which it oversees Bryan, Camden, Chatham, Effingham, Glenn, Liberty, Long, and McIntosh. Its counties is to improve the health of those who live and work and play in those counties by preventing illness and injuries, promoting healthy behaviors, and protecting them from harm. Some of the programs that the Coastal Health District oversees and provides for the community are adolescent health and youth, development programs, child health services, environmental health, epidemiology, health promotion and disease prevention, health HIV/AIDS services, immunization records and vaccinations, it has a tuberculosis program. You can also get your vital records from the public health and the Coastal Health District, women's health services, and patient privacy. Here's a picture of me and my site supervisor on my first day. I actually assisted her in HIV testing at Savannah State University. My site supervisor's name is Diane DeVore. She is the district's communicable disease prevention specialist and health educator. She is in charge of overseeing all the prevention methods and all of the communicable diseases within the entire district, specializing in HIV cases, syphilis cases, gonorrhea, and chlamydia cases. I actually got an opportunity to network and meet with her prevention team. Here you have Derwin. He's in charge of all of the outreach programs in the entire Coastal Health District. You have Katrina, who's over the entire Brunswick District and down in the lower counties and STD cases. You have IDMA, who's in charge of overseeing the HIV clinic and working with all the HIV cases that come through the HIV clinic. You have my site supervisor, Diane DeVore, who oversees all of them. Then you have Kenny, who oversees all of the hospitals within the Coastal Health District and their HIV cases. And you have Devin, who is your new HIV linkage coordinator for the whole entire health district. And you have Ms. Linda Green, who's in charge of HIV cases at Eisenhower Public Health Department. During my practicum, I learned many things when it came to working with HIV cases, syphilis cases, gonorrhea cases, and chlamydia cases. I was able to actually go out in the field and work with my site supervisor and linking patients to care and tracking down patients if they hadn't been cured or been treated by the disease that they have. I was also able to help my site supervisor in filling out case reports, so actually learning how to do that, and actually able to help her when it came to setting up testing events across the whole Coastal Health District. Here are pictures from several testing events that we did. Here's for World AIDS Day, which was on December 1st at both of the Walgreens on Victory Drive and in Garden City, where we tested over about 220 20 cases, and all of them were negative. Here is us partnering with the social work department at Savannah State, where we did an HIV testing event at Savannah State, where we tested over 300 Savannah State students, which was very successful. So I actually got to be in the field getting real work, learning actually how to give HIV tests and actually seeing how HIV tests and the prevention side of HIV and other communicable diseases within our health district. I was also able to attend National Gay Men HIV/AIDS Awareness Day luncheon at the Powerhouse, where we hosted luncheon where we had our guest speakers, Dr. Guerrero, who works at the HIV clinic, and our new PrEP clinic nurse practitioner, and other HIV ambassadors and local activists for HIV within the community, where we had a luncheon and a panel discussion basically talking about basically the questions that are being talked about within the community to basically get a consensus on what's really going on in the community. I was also able to get HIV certified, HIV testing and counseling certified with the Georgia Department of Public Health. Here's my certificate. So now I'm actually able to give HIV testing and counseling online or in-person training to anyone who wants to get certified with HIV or counseling. So if you need to get tested, I'm the person now that you can possibly come to get HIV tested. So good, and thanks to my practicum that I was able to get this certification. It will help me when I, after leaving the graduate program. In conclusion, while interning with the Coastal Health District, I was able to assist and help with many events like the National HIV Testing Day, testing at Savannah State, and Masters of Social Work Department, and National Gay Men and Awareness Day, and World AIDS Day. These events overall were a blast, and I was able to learn so much and meet so many great people and network with them. I would recommend this internship to anyone who wants to do a practicum with the health department. Ms. Diane DeVore is a very great instructor, and she taught me so much that I didn't learn while in the actual program. So after this, I plan on studying and furthering my career and getting my doctoral dental surgery. So after this, I'll be studying for the DAT, the dental admission test, in hopes that I get in. And I look forward to meeting great people, and I will always remember my public health partners and colleagues at Georgia Southern University. I love you guys and thank you so much for this opportunity and teaching me so much about public health and the overall health of the public. And also, I don't know if you know this, but the World AIDS Day flyer that was posted around the city and sent out to all the community people in promotion for public health, I actually created the flyer for this year's 2018 World AIDS Day. So congratulations to me on that, pat on the back, and thank you and thank you for this opportunity. Thanks.